So for my part of the PowerPoint, I had issues patients face when dealing with diabetes. Diabetes causes a lot of mayhem in people's lives when they have to deal with it. People with diabetes are at risk for facing issues with their eyes, kidneys, feet, heart, brain, and their nerves. Not only do the patients deal with these issues, but the family members have the backlash from these issues. So for eyes, diabetes can cause cataracts, which gives you cloudy vision. It can cause glaucoma, which has pressure on the eyes, and it can cause retinopathy, which is a detached retina. So it can cause issues for transportation, driving around, simple tasks like getting to a doctor's appointment and coming home. Kidneys, it affects your kidneys. So when a patient has diabetes, it's recommended that they get a yearly protein test done on their urine. And if protein goes undetected, it can give them kidney disease, and it puts the patient at a higher risk for having more medical issues, going on dialysis, which already causes a lot of issues with blood and such. It causes issues with the heart and brain. All people with diabetes have a higher likelihood for heart disease and stroke. Heart disease is the #1 reasons for death in patients with diabetes. Neuropathy is also a disease that affects somebody with diabetes, and it is a disorder that attacks the nervous system. And lastly, the financial issue that it causes patients with diabetes and their families. According to the American Diabetes Association, the average cost of healthcare for a person with diabetes is $16,752 a year, which is twice the cost of a person without diabetes. Under current law, insurance providers aren't allowed to refuse somebody with diabetes insurance coverage, but it doesn't protect the person with diabetes from the premiums they have to pay out for getting insurance. This also affects families because if they don't have insurance, the amount of money they have to pay for insulin, their special diets, healthy food, healthy drinks, and the issues it causes on the body, it affects the way they can work and if they can get out and be a functional member of society. So overall, issues for patients is very extensive, and the financial one is a big burden.